Welcome again. We want to talk about different type of breast. Number time you will hear normal breast. What does this mean? There is no such thing as the perfect or perfectly normal breast. A breast comes in all shapes, sizes, colors, and all that. And I want you to know that even on the same person, one breast can be a different size or shape than the other. At times, when I was growing up, I noticed that my left breast was bigger. At the time, it was like the right was big. There's nothing, any shape, any size you have is just normal for you. And at times, the nipple and the surrounding skin with the dark, a place called areola varies in size, shape, and color as well. Not only in shape and the size. Then at time you see some nipples stick out, some lay flat, some point inward, some point inward, some point outward. And the areola, the darkish area, can be light pink. Some of us can have brownish black or any shade in between that is neither here nor there. Of course, you might or might not have ears around your nipple and stretch mark, but some might have. You understand? So we have variations when we are talking about breast. So don't let somebody tell you though you don't have normal breast. Whatever shape or size or color, whatever, you have normal breast. And what is normal for you can change over a lifetime. You understand? It can be there, it can change or something. And at times I want you to know that your breast goes through changes when you have period, when you are pregnant, when you are breastfeeding, when you are ready for sex. At times you see the breast engorge because of blood. And of course, when you go through puberty, they change. And at that time, its size flip. It becomes, most of us, you see it. And of course, it changes during menopause too. Then of course, they change when you gain weight or lose weight. At times, your breast might change in response to some birth pill control that we use, or when you are going through what we call hormone replacement or hormone replacement therapy or something. If you are a transgender woman and you are taking hormones, what happens? You will have breast changes. They are just natural things that we should know about. You understand? They are natural because all those drugs that you are using as a transgender can make a whole lot of difference in your reproductive system, and your breast is inclusive. So it's a good idea to get to know your breast. Pay attention to when they change. You understand? Don't sometimes when you are taking people's history and you ask them how was your breast before this, and they say they don't know. It's amazing. It's absurd. So you can know when to relax and when it might be what to call a doctor or visit a doctor. So we're going to be talking in this video different breast shapes. Healthy breasts come in lot of shapes. You can see some, they are so big, some are just tiny, some are flat, some are saggy. But if you are not sure how you will describe yours, plastic surgeon and bra makers have some terms that might help you. You understand? And of course, what do? They often describe breast shape in different forms. So you'll be able to pick which one is yours. So it was during the time I was studying for this video that I found out the type of breast shape that I have too. Number one is round or archy-type breast. And of course, this one, they are evenly full on top and bottom, both below and up, they are full. Then, of course, we have what we call teardrop breast. They are fuller on the bottom rather than on the bottom. This is the bottom rather than the top as a woman. Then another one, we have asymmetrical breast. They are even uneven in shape and size. This one is different from the size of this one. The shape of this one is different from the size, the shape of this one. Just within somebody's within your body. Then we had wide breast. This sit far apart from each other on the other chest. These are just like this. This is just like that. That is the wide breast. Then we have the closed breast. These are close together on your chest. They are closely knitted as if you are packing it together. Then apart from that, we have the tubular or the conical breast. They are long, they are narrow and less rounded. They are not as round as the first type that we described. That is just round. You see it's round like orange. Then we have relaxed or saggy breasts, which may appear to droop, maybe after one pregnancy, after breastfeeding of your baby or something, as a result of either weight loss or aging or stress of pregnancy or something. But when you know your breast well, it is easier for you to notice when there is any abnormality. When something goes wrong or something changes, it is easier for you to know. That's the reason. Then I want you to know most of these changes are not signs of breast cancer, because I've met a lot of women. If they have ordinary scratch in their breast, they'll say, "Is it, auntie? Please help me. Is this cancer?" No, it's not. It's not cancer or any other serious problem. But some do warrant a check. Might warrant a check with your doctor. You understand? So there, in this video, let's dive into what to know about breast issue that you may notice. You understand? And you want to do what? You will go straight to your doctor. That will be in the next video. Bye bye for now.